Hi, welcome to Arizona Balance and Hearing Aids. My name is Jordan and I'm one of the residents here at ABHA. Here is what you can expect for a tinnitus evaluation with us. Prior to your in-person appointment, we will schedule a telehealth video conference to review your case history with the audiologist and/or resident. You will be sent a link to our patient portal to complete our questionnaires. Please complete this documentation at least 24 hours prior to the scheduled video conference. If documentation is noted as incomplete by then, our front office will contact you to reschedule your appointments. Due to COVID, we ask that you arrive no earlier than 5 minutes before your appointment, as our waiting room is closed and we do not want to crowd the entrance. You will also have your temperature taken and will only be tested if it's normal. We also sanitize all equipment used and have plexiglass barriers in our rooms. All staff members will be wearing masks and we will be sanitizing our hands throughout testing. If you do not bring a mask but would like one, we can provide you with a cloth mask. The appointment will begin with an audiologist and resident asking you some questions related to your hearing and health history. Once completed, we will begin by looking in your ears. We do this to ensure we can see the anatomical landmarks of your ear canal, eardrum, and bones behind it, and make sure there's no redness, fluid, holes in the eardrum, or excessive amounts of earwax. Next, we will match your tinnitus aloud for the audiologist and resident to hear. You will hear 2 sound options from a nearby speaker, and you will be asked to determine which is the most like your tinnitus sound. Once the sound has been determined, the audiologist and resident will ask you to listen to the pitch and loudness of your sound to help us make adjustments to the speaker sound. The goal is to get as close to simulating your tinnitus sound as possible. This step is important to ABHA as it helps us determine which interventions would be most appropriate for your sound. Then we will put an earphone in your ears. You will feel pressure and hear tones. This test is making sure the eardrum and bones behind it are moving normally. Following that test, we will be putting a different earphone in your ears. Again, you will hear some tones. This test is measuring the health of a certain type of sensory cell in the cochlea or the organ of hearing. These cells help us differentiate between sounds at soft levels. Now you will move into the sound booth. Here you will be tested on the lowest level. You can hear tones of pitches that are important for speech. You will also be tested on your ability to understand words in quiet and background noise. Lastly, we will discuss the results of these tests, and based on the source of the tinnitus, the audiologist will make recommendations regarding your hearing and your tinnitus. Every individual evaluated for their tinnitus will receive a folder containing our tinnitus recommendations. Each and every recommendation will be customized to your individual needs. We look forward to seeing you in our office soon. ABHA partnering with you to better balance, better hearing, and better life.